What if we told you that ejaculating more might actually reduce your risk of prostate cancer? Well, don't just take my word for it. Let's dive deep into the science behind this, and if you like our content, make sure you subscribe and hit that notification bell, so you don't miss any of our new videos. So, why does this even matter? Well, prostate cancer affects 1 in 8 men during their lifetime. That is not a few people. Where that number is 1 in 8, and some countries have a lower incidence of prostate cancer. So, if we can change something in our own behavior that can help reduce prostate cancer risk, well, why not? Why would ejaculation have anything to do with prostate cancer? Well, for those of you who don't know, the prostate's primary function is to create a fluid that you secrete during ejaculation that actually nourishes and protects sperm. And so that fluid essentially builds up in the prostate in between ejaculations. There are a few theories why ejaculation may be correlated with prostate cancer, or not having enough ejaculation. And the number one predominant theory is called the prostate stagnation hypothesis, and that is that over time, if you're not releasing that fluid, you can get carcinogenic secretions, or secretions that are concerned for cancer promotion, and that can then cause the development of prostate cancer. Some other theories may be that when you're ejaculating more frequently, you may have lower psychological stress, which can also be correlated with developing cancers. And the last theory is that having normal rates of ejaculation, or more frequent ejaculation, allows for what we call a normal prostate microbiome, and also the normal function of the prostate cells regarding zinc and citrate metabolism, which are important for the prevention of prostate cancer. So, there are reasons people thought this was an interesting question to study. And what did they actually do to study this? So there are a couple of really interesting things. This study was actually a survey done of over 40,000 men in 1992, and they followed these men until 2010. And why is this important? Well, prostate cancer is a really slow-growing disease, and so what that means is that you have to follow people over greater than 10 years to really see if the thing that you're seeing 10 years prior actually made a difference in their development of prostate cancer. And so they took men, and they had them answer several questions, and one of them was about, on average, how many ejaculations did you have per month during these 10 years? And the 10 years were between ages of 20 to 29, 40 to 49, so on, and so forth. And so, people had to kind of think back, and remember and estimate how often they were ejaculating during that decade of life. And these men were asked to take surveys every other month. They also asked them about their physical activity level, their weight, their smoking history, if they ate processed meat, tomato-based products, alpha-linoleic acid, if they've ever used a multivitamin, if they had life stressors like divorce going on, and just several questions. So they tried to control for all these factors ultimately to determine if ejaculation frequency was indeed correlated with a lower risk of prostate cancer. And one important thing that came out of the study is they actually saw what ejaculation frequency was in this large cohort of men over decades of life. And it was very common to see that ejaculation frequency decreased with age. So, when they looked at men who had ejaculated at least 13 times per month between the decades of 29, about 57 of men said that they had ejected at least 13 times or greater, but that dropped to about 32% at 40 to 49. So, when they looked at all the data, they kind of categorized all these men into different categories, and those that ejected 0 to 3 times, there were very few men that fell into that category. So they didn't use that as their comparison, and so, they then compared those who ejected 21 times, or more, to those who ejected 4 to 7 times per month. I mean, 21 times is a lot. That's like 5 or more times a week to ejaculate, right? That's a lot of time to ejaculate. And so by the time they looked at all this data, these men were on average about 59 years of age. And they saw that the men who ejaculated between the ages of 20 and 29 and 40 to 49 ejected 21 times or more, compared to those who ejected 4 to 7 times had a 20% less likelihood of getting low-risk prostate cancer. This wasn't true for high-risk prostate cancer, or more aggressive prostate cancers with metastasis, but certainly a low-risk prostate cancer. They were 20 less likely to get this diagnosis. So, the reason we brought this study up, the study was done in 2016. But the reason we wanted to talk about it today was because we just started seeing news articles posting about this paper again about 2 weeks ago. And so we said, you know what, let's talk about this, because all the articles just said ejaculate more often. So is that what you really should do? Well, we think you have to look at these studies critically, and this was a really well-designed study. They followed people for a long period. They had really an excellent team of researchers and statisticians, and they controlled for a lot of different factors that might also cause a lower risk of prostate cancer, but you have to think about it. Those who are ejecting 21 times or more every month are probably either a different type of person altogether than someone who's ejaculating 4 to 7 times. They might be more physically active or more physically fit, so they're having more intercourse more often. So we think the real question is, should you ejaculate more often? Based on the data of this study, well, we would say that while this is a really well done study, and they controlled for a lot of factors like physical activity, stress, food intake, carcinogens in food, lots of things like that, it's still not 100% sure we should prescribe all men to ejaculate 21 times a month, so that they don't get prostate cancer. We think it's an important question. We think that if you are ejaculating very often, that's not a bad thing, and you can certainly continue to do that. And if you're holding back because you think it's bad for you, well, probably it's not bad for you, and you can ejaculate more often. But when we tell you, you have to do it to the detriment of your social life and physical functioning and everything else that you do normally for a month? No, we don't think so. So we hope this is interesting for you. All we thought was interesting, and so we wanted to share it with you guys. Thank you so much for watching as always. Take care of yourself because you're worth it.